Chapter 6 Pediatric Considerations. Pediatric patients can present certain complications. This is especially true in pharmacology. When dealing with absorption, factors like the child's age, health status, weight, and route of administration can play a key role. This would also be combined with things like their nutritional habits, physical maturity, and hormonal differences. Also, hydration, underlying diseases, and GI disorders as well. When considering the route of administration, the gastric acidity, emptying, motility, surface area, enzyme levels, and intestinal flora. Also, topically, children's skin is thinner than adults and will absorb much more rapidly. Also, in the case of IMs, peripheral perfusion and the effectiveness in circulation should also be considered. When considering distribution, influencing factors would be changes in the patient's body fluid composition, body tissue composition, protein binding capability, and the effectiveness of barriers such as the skin and blood brain barrier. Influencing factors for the pediatric patient's metabolism would include things like their maturity level, liver metabolism, reduced hepatic blood flow, and reducing drug metabolizing enzymes. When considering delayed excretion, the pediatric patient's kidneys have decreased renal blood flow, a decreased glomerular filtration rate, and decreased renal tubular function. When considering pediatric pharmacodynamics, the mechanism of action and effect of a drug on the body, including onset, peak, and duration of the effect of the drug, should be carefully considered. This would be in addition to the intensity and time course of therapeutic effects, as well as adverse effects. And monitoring, as well as for therapeutic effects and adverse reactions. Calculations of pediatric dosages are going to be weight based, and this is something we're going to cover a lot this term. In the case of pediatric drug administration, we need to consider the development and cognitive differences. The family centered care, meaning how involved are the parents, how much family support does this patient have? We also are going to place safety at a top priority, as with every patient, but especially so in the case of pediatrics. Directed towards teaching, we want to focus this teaching on both the family as well as the patient. It's important the pediatric patient is able to understand the reason for the drug and why they're taking it. We want to consider things like their level of knowledge, their developmental age, anxiety level, and when communicating with the pediatric patient as well as their family, that everyone's on the same page and understands the reason for this treatment. We want to focus on decreasing the pain and anxiety in the patient wherever possible, with tactics like distraction, diversion, relaxation, creative imagery. Prioritize oral administration over any injections, and utilize honesty, respect, explanations, and do everything we can to comfort this patient while using the least amount of restraint possible. Considerations for older adolescents would include things like their physical changes, again, their cognitive level and and abilities that can vary wildly, emotional development, their independence from their patients, their ability for self care, and the impact that chronic illness is having on their lifestyle. Also, pay careful attention to that nurse patient relationship. You want to build a rapport with both the family as well as the patient. And again, be very aware of getting an accurate med reconciliation as well, as we want to know everything not only this patient's prescribed, but also everything they're taking over the counter and any alternative medicines as well. Again, when assessing this patient, we want to pay careful attention to their age, weight, height, cognitive level and developmental age, learning style, and especially allergy history as well. More and more kids and pediatric patients are arriving with severe allergies. Work collaboratively with both the family members as well as other caregivers to demonstrate safe drug administration practices. Follow all rights of safe drug administration, those six rights, as well as assist the patient family to use follow up resources and support. Make sure they know who to contact should they have any additional questions when they get home. The first practice question: at what age does a child begin to metabolize enzymes at an adult level? That be A, infancy, B, 2 years old, C, 11 years old, or D, 16 years old? And that answer is going to be C, 11 years old. For question two, although adolescents have physical appearance and organ structure, as well as functions similar to that of adults, the nurse understands that their bodies continue to grow, requiring the nurse to increase vigilance in monitoring which area: A, therapeutic and toxic drug levels; B, side effects of medications; C, the route of med administration; or D, the frequency of med administration. That answer is going to be A, therapeutic and toxic drug levels. Because again, this can be influenced by a wide variety of factors related to absorption, metabolism, distribution. Question three: what is the most appropriate method for the nurse to administer oral medication to a toddler? A, in a nipple; B, dipped in a pacifier; C, via an oral syringe; or D, mixed with formula in a bottle? That answer is going to be C, via an oral syringe, also put into the buccal pouch into the cheek, especially for younger kids. For that's answer D in there. Keep in mind, never mix medications in formula. Not only is it full of calcium that could bind to the medication, but what if the patient doesn't finish the bottle as well? And finally, for our last question, drug calculations for children are based on which factors? A, sex; B, age; C, weight; or D, height? And that answer listed for select all that apply is age, weight, and height. But keep in mind, weight is going to play a key role, especially when we start talking about all of our pediatric dosage calculations, as many of them are going to be weight based. But anyway, that's all we got for this chapter. I'll see you in the next slides.